going to check the doctor's order for use of insulin spirometer and see how often I have to use it and if they have an isolation precautions. Usually the doctor will say 5 to 10 times per hour. I'm going to make sure I wash my hands, and like as usual, I'm going to explain, introduce myself, knock on the door, introduce myself, and explain the procedure of the patient and what they're going to do. And I'm going to make sure I have the bed up to working height, and I'm going to provide privacy as needed. Now, if the patient's having a lot of pain, you want to splint. As previously with the sputum specimen, you want to put a pillow over the abdomen to splint their chest. And also, you might have to medicate them so they can be able to take deep breaths if they're having a lot of pain. The patient should stay up in an upright position, and we want to instruct him on how to do with the insulin spirometer. So when he first goes to use this insulin spirometer, you want to make sure that we set a goal for the patient, and the goal should stay right here. There's a smiley face that's on here. So when you actually inspire into this, or inhale, you want to make sure you keep in that area, and you want to set a goal. Usually when people first start out, they're very small. It's very small milliliters, and then as soon as they work up to it, usually you try to get up to about 1,500 or 2,000. So you want to instruct them to take a deep breath in and out through their mouth. Then you want to have them put their mouth on the mouthpiece, and you want to have him inhale and breathe deeply as they can. And then you have to take the mouthpiece out of the mouth and you let it go back down. You want to have them do it 5 to 10 times per hour. Now the patient can do this and give a return demonstration to you, and make sure they do it 10 deep breaths. You can have them do it every hour at the hospital. You can have them watch the commercials. Every time a commercial comes on, you can have them do it once. You also want to make sure when they inhale, they hold their breath for about 3 seconds. A lot of people can't do that. And then make sure after 10 deep breaths, take a cough. And of course, the incision splinting will help. When the patient is able to, you want to make sure, teach him to monitor his depth on here, how many milliliters, and have him to return demonstration, approximately. And also make sure that he can monitor how much he's inspiring, as far as his respiratory expiration. So make sure he's breathing deeply. When we're done, we're going to take and evaluate the response to the procedure. So Mr. Pierce, if you're having any pain, anxiety after you did this, or any shortness of breath, no? We're going to put his bed back in lowest position and make sure his top 2 rails are up and the call light is in reach. And then Mr. Pierce, if you need anything, just give me a call at this call bell. And we're going to make sure we wash our hands and that we're going to document our patient teaching. So I taught the patient, how to use an insulin spirometer to get up to like 1,000 milliliters. And patient stated he understood teaching, was able to perform return demonstration.